Hi, this is Tony again with Alamo Slim Clinic in San Antonio, Texas. And what I want to discuss today, I get a lot of questions about on our GLP-1 medicines for weight loss, the semaglutide, tirzepatide. Are there options for people that are afraid of needles? Not everybody is okay with getting weekly injections. And lately there have been options coming out on the market for what we call sublingual. That means under the tongue or oral options. Yes, we have them, and I have access to them. In our clinic, we stock the injections. You can come into the clinic and we can give you weekly injections or send you home with the medicines. We always have them in stock. But for the options for sublingual, we would have to order and we'd have it in for you in a couple of days. They do have a shelf life on them. They're not as popular, so I don't have them in stock. But I do want to talk about the efficacy of those options. I can get them for you, but the studies so far, and talking to all the doctors and the clinical trials that have been done on the non-injection options, are that they work, but they might not work as well as the injections. And let's talk about why. For the injections, we're getting the medicine directly into our bloodstream. We do a subcutaneous injection under the skin into the fat layer, but not into the muscle. But the majority and all of that injection is going right into your bloodstream. So the doctors and we know exactly how much medicine to give you, and all the clinical trials have worked that all out on how much the shot needs to be to get you the results you're looking for and not get you too nauseous and have too much side effects. But on the sublingual, they're still studying exactly how much we need to put under the tongue to make that get enough medicine into your system to work properly. What do I mean by that? Well, if you swallow this medicine, it goes through our digestive system. A lot of the medicine is destroyed. So by putting it under the tongue and letting it dissolve and get into your blood vessels that are under our tongues, it will work. But a lot of people aren't patient and don't leave it dissolve under there. They swallow the juices instead of letting it sit there and soak into the blood vessels. And they're not exactly sure how much of that medicine is getting into there. So they did a lot of clinical testing. They found that it works, but not as well as the injections. So doctors, and we're having to give you maybe a little bit more to make sure that because it's not all absorbing, so we got to give you more to get less into you. So there's a little bit of a mystery there, but I can get them prescribed by our doctor. If you are averse to needles, some of the other benefits to the sublingual are it's easier to travel with the oral options. They are daily. You take one daily instead of weekly injections. So one of the other benefits to that can be leveling along all 7 days. You take one little tablet under the tongue every day. For maintenance dosage, this could be the way to go. So instead of trying to lose a lot of weight with the sublingual, they found that it's not as effective. But to maintain your weight, not gain your weight back, and be on the GLP-1s as a maintenance dose, the sublingual might be the optimum tool that when you know you need it, you can take it. When you don't want it, you don't. Your system isn't loaded up on a lot of medicine for the week, so you can lower dose yourself. So I like that option for my patients that might have already met their weight loss goals, but they don't want to be hungry all the time, so they kind of want a steady low dose. The sublingual might be the best option for that. So either way, we've got you covered, and we can discuss the pros and cons. We have all of these options. Again, Tony at Alamo Slim Clinic. Hope to meet you soon and answer some of these questions for you. Take care.